So good afternoon, everyone. This is Audrey Russo. So happy to be here on another beautiful Friday in Pittsburgh, although it's Friday the 13th. I don't know.
Her lucky day. It's all good.
That's a little, superstitious. That's okay. It's a great day. It's a beautiful sunny day, and I want people to be safe. I know that our numbers for COVID have increased, and we're getting into the holiday season. So please continue to be safe and remember to wear masks and not congregate en masse. So we're thrilled about our guest today. We have a long-standing partnership with Highmark, so we're really glad to be able to talk about behavioral health after so many months in COVID, and so many different issues have manifested themselves in terms of our people and in terms of their support, et cetera. We're going to do a little dive with a leader, a director at the behavioral health as part of Highmark. I'll introduce him in a moment. So I want to say thank you to Huntington Bank. Please, if you know anyone at Huntington Bank, thank them because they've believed in us right from the onset. Jonathan Kirsting, Vice President of Marketing and Media at the Tech Council, is with us as always. He's going to make sure that the questions are being attended to. And he is our ultimate storyteller here at the Tech Council. So if you don't know him and you want your story to be told, reach out to him. And we've muted your chat. We've muted your voice so that we don't hear anything in the background, but we have not muted the chat. This is not an opportunity to sell your wares. This is an opportunity to discuss the matter at hand. And the matter today is behavioral health. So I'm going to jump in now and welcome Demetrios Marousis to today's show on Business as Usual. And as always, I want to jump in and say, how are you, Demetrios? And who are you? And give us a little bit about yourself. And thank you for taking the time with us today. We really appreciate it.
Oh, thank you for the opportunity. And as you mentioned, I'm Demetrios Marousis, and I'm the director of behavioral health at Highmark. I've been doing behavioral health related themes since, mid-'80s.
So what does that mean? What does that mean, behavioral health?
Well, so I, as a clinician, I was, in the service provision space for about 20 years, and for about the last 15 years, have been in the managed care space, sort of on the sort of the payer side, managing our members' access to their benefits and promoting access to benefits. Behavioral health is typically underutilized.
Mm-hmm.
People could use it a lot sooner than they do. And our goal is to identify and provide that sort of full access to their benefits through our network, as well as the right level of care.
So, thank you. So you have actually been a practitioner and now you're directing the behavioral health services there at Highmark, right? Am I capturing that correctly?
That is correct, yes.
So, here we are, I don't know, 8 months, 7 months into COVID. We've have, interesting things happening, right? With the rise of COVID again, we're entering into the winter, although it's been amazing weather here in Pittsburgh. And we, as people who lead people, and many of the people who are in our audience today are they're in the tech community. And we are working from home. Many of us are working remotely. Many of us are working hybrid. And the demands and the boundaries of our life have shifted. Responsibilities around kids have changed in terms of school, family members, trying to keep people protected. We're juggling a lot of balls. And what I want to start with you is just to talk at the high level. What are you seeing? Is there any changes over this 8-month period? Are you seeing some trends, some things that you'd like to talk about at the macro level?
So let's start with, I'll start with before COVID. Mental health, it was sort of an underrepresented theme. And one of the reasons it's underrepresented is stigma. People who are sort of feeling off, basically that sort of work ethic that most people hold. Well, I'm going to shake it off. I'll work through it. I'll tough it out. And the reality is, research really suggests that people are symptomatic for a good 8+ years before a good diagnosis in many cases. so in essence, you've got somebody struggling with a diagnosable, treatable condition for that long. And so I think the power of stigma, the power of not talking about it, not having sort of language that we can readily sort of reflect on and share about, and sort of, find a way of sort of interacting, I think is significant. Now, that was there before. And before COVID, we,
Right.
In a given year, about 22, 24% of the population in the United States would have had an experience with a mental health condition. So that's significant. Now that we have COVID, as you mentioned, it's been a disruptor, and not only did it, it sort of close things down, but it disrupted our routines. It disrupted our context, our social context. It disrupted the context that we can have conversations in. And in that context, it sort of limited then sort of the sensory sphere. So now we're going on more text messaging, more emails. What does it mean when somebody is on a Zoom call and gosh, they don't have their video on? And I want to go back to that sort of the power of routines of, okay, I'm waking up, I've got this, and I've got to hit the clock by this time to get my commute.
Mhm.
Otherwise, I'm not going to get through the tunnel,
Right.
by this time. And I've got this meeting that I've got to be at my seat by this time. And oh, by the way, I really want that coffee from that coffee shop that's 2 blocks this direction. I've got to, those are all things we accommodated. And they were all sort of, in many ways, self-care things.
Mm.
And so the immediate thing is that sort of all of that shifted, and it shifted dramatically. And it shifted with, some initial optimism. Oh, this is going to open up again in this short order,
Mm.
and things are going to be this way. And it also was sort of in the face of incongruent and conflictual messaging. What is the best way to keep safe? What's the best way to keep my business going? What's the best way to keep my employees congruent? And all the chatter and all the different opinions about that sort of leaked into everybody's daily conversation and was somewhat polarizing at times. So all of that, sort of added sort of additional sort of stress, uncertainty. And I think the other piece of it is sort of the persistence now. Here we are. So March 12th for me was the
Right.
last day I was in my office. And so here
Wow.
we are, mid-November almost. And, and there's sort of a weariness that I think most people can sort of relate to. And I say weariness is sort of the, sort of mild. Some folks are really dragging at this point in
Mhm.
time. Now, if you can sort of accumulate all the loss that individuals have sort of accumulated, the graduations that people didn't get to go to, the weddings, funerals, 4th of July, Memorial Day, different things, parades, kids' sort of sports seasons,
Right.
soccer's, baseballs, and how those have all been sort of truncated, modified, adjusted in many ways, and done in many ways unevenly. So if you look around to another community or hear somebody else, they, may act as if there are no restrictions, whereas your community may have buttoned it down.
Right.
So I think all of that is sort of what needs to sort of factor into this sort of persistent weariness that's
So
going
you
on again.
mentioned earlier, you mentioned at the onset of what you were just talking about that 21 in 4
Yeah.
people have experienced what? Can you describe
Well,
that? Like,
so
what is that?
yeah, they would have had something that, a mental health condition. Now, these can be transient; they can pass, and not all require. So if we look at it as sort of a continuum,
Mhm.
sort of what is stressful for one person is sort of ground, sort of shattering for others. And so you also then have to look at individual capacity to handle some of these things. And that capacity is really developed early in life,
Mhm.
based on sort of our early development. And even though, there are people that have sort of, overcome many things, the fact is that early development still locks in some of our capacity to handle this kind of stress, especially when our sort of agency, and by agency, I mean our
Right.
capacity to sort of affect our outcomes, our day-to-day, our, our pathway through the world. If that agency is affected, then we also then experience that limitation. And not only do we sort of miss out on sort of that stress reducing stuff,
Mm-hmm.
but we also sort of feel poorly, and we, have additional sort of grief and loss associated with that.
Yeah, it's interesting. So has there, in terms of the services, and then I want to get back to this whole thing about grieving, in terms of the services and the demand for services, has that changed over these last 8 months?
Well, what we've seen, and what Highmark, actively did, is sort of recognizing that this sudden disruption in services is going to be significant, and it's going to be significant, and that we had some, our members. There's a cohort of our members
Mhm.
that were going to be significantly vulnerable. So those that were in existing care, and suddenly that care was disrupted. So turning on capacity for telemedicine and promoting it, and working with our providers to pull that off. And what we found is that we've had sort of thousandfold increase in the use of telemedicine. And so providers really up their capacity, up their competency, and sort of developing the connectivity to do it.
Mhm.
And what we're finding is that it's sort of, if there's a positive about this whole thing, is that sort of COVID sort of provoked and escalated sort of the maturation of sort of telemedicine channels of service delivery,
Yeah,
not
sure.
just in sort of medical, the medical field, but also behavioral. So that sort of adoption and the experience with it, and the sort of the positive sort of feelings around it, I think are positives for us, and are likely to increase in the future.
So, yeah, and hopefully the stigma starts to erode through this.
I would hope so, because I think once now people are more readily able to talk about experiences of stress and experiences of anxiety, and potentially pursue treatment.
Well, one of the things that we're hearing, just statements in the chat, it's around grief. If I can cluster it around grief and loss, right? The grief and loss about not being able to attend things, not be able to do things that are incidental, having family that are spread all across the world, or even all across the United States. So it's really around grief that I'm hearing the reactions to right now, as well as what can we do as, I mean, obviously, maybe we should learn about, death and dying in terms of the stages of grief. And as leaders, we should learn how to embrace that. But what should we be doing? What's the advice that one of the things that I hear is that people are so productive. People are so productive now that they're working hybrid or they're working remotely. Well, I worry about that. And I've heard that from many leaders, that the blurriness that we had before with tech, it's just, grown exponentially.
Yeah. So once again, So productivity could be a measure of of whether somebody is struggling or not struggling, or somebody is sort of masking other things by their overproductivity. Who's now putting in extra hours. I mean, because it's easy. You just wander from one room to the other room of your house at this point.
Right.
And you log on, and is sort of the amount of time logged on the best measure? Or are we truly seeing that productivity shift, or are we seeing people that are they're visible, they're available, but we're maybe seeing nuances that there may not be as productive?
So
That may be a function that we need to look at.
So what are some signs? What are some signs of knowing, as a leader, that, or even as an individual, that we should seek help?
Well, I mean, so once again, so behavior change, so are we seeing somebody's productivity shift? We're seeing them less productive. We're seeing deadlines getting missed. We're seeing sort of changes in appearance, and I'm not just talking bad COVID haircuts, that kind of thing. So this is my latest COVID haircut.
Is it? It looks good.
Yeah. My son helped me out in the garage. But so it's the change, and it's also sort of the availability of, who's not on video and sort of why.
Right.
And I'm not trying to say compelling people to be on video is necessary, because this can be a bit much at times. How do you balance it? And I think sort of the way out of it is this sort of almost necessary curiosity that's led with empathy about how people are doing, because we don't get to hear about things that we're not talking about. So as sort of employers, as leaders, I think we have to ask the question, and it goes beyond how are you doing. Well, we have to push for the answer. We have to remember, hey, last year, didn't you usually have this sort of big gathering at this time? What are you guys doing instead? And sort of digging into it. How are you handling that? How are you managing that difference? Gosh, wasn't your kid lined up to, get some sort of scholarship to college based on his baseball, and you didn't have a season this year? How's that playing out? What are those prospects looking like? Those are all sort of things that occupy a person's life, and not one of them by themselves I think is going to be massively the most meaningful piece, but it's that sort of pursuit of it. And I think the emphasis is on that pursuit of sort of interest in your employee, in their well-being, because once again, their well-being means that they're more likely to be present, and not just sort of signed on, but absolutely present. And you're going to get that presenteeism that's sort of absent of all the distractions and diversions that are out there. And you're going to get more productivity. So in 2019, the World Health Organization talked about mental health and the impact on just sort of, lost productivity. And they quantified it to be about $1 trillion, strictly related to mental health issues and concepts of presenteeism. So even though somebody shows up, if they aren't at 100%, you may only be getting 60% in a given week from them because of diversions and distractions going on. And some of that stuff is absolutely treatable. And, some of the solutions would be referrals to the APs. Call the number on the back of your card, find a provider, talk about what's going on, and get linked to the right level of care.
Jonathan asked a question. Jonathan, why don't you ask yours, and then I see Lisa, and there might be a couple of others.
Dying to know this.
Question to Demetrios.
Definitely. So is there a real mental connection with Zoom fatigue? We find out that after being on 7, 8 Zoom meetings, it's more tiring than actually being in real life meetings. Is there something to that?
Well, I think there is, because once again, it requires, sort of a level of attuneness, and you're without sort of some of your sensory experience, so the Zoom meeting, you're not walking from, the same corner of the floor to the conference room, and on the way, you're touching base with your colleague. Zoom meeting right now is you're appearing.
Exactly.
And you're right into the agenda, and you're done at noon, and then 12:01 you've got your next meeting, and it's just a few clicks away. And so even that sort of stroll from one meeting to the other when you had in person, and even you may have had those days where you were back to back regardless, but that wasn't every day.
Exactly. And it was different because it's like you log on to a Zoom meeting, the next one, it's just like you're just focusing on this.
Yeah. And some folks had sort of travel that sort of broke things up. They were out of the office, they were on the road to the other side of the state or somewhere else, for a face-to-face conversation elsewhere. And once again, that the stimulation of all of that is significant. So even though we may be able to accomplish many things, the shift, the difference in it, you don't get that sort of respite. You don't get that sort of collegial lunch out. Hey, what are you doing for lunch today?
Right.
Oh, I've got a break. Let's go. I can go for here. What do you want to eat? And oh, there's this new place. All of that is sort of, I think sort of gets into that sort of a, lost pile. And not to sort of,
maybe it's like it's dehumanizing almost because we're just like these matons like just
that's right.
in
Yeah.
front of the Zoom screen.
Yeah, when what you see now is some of the folks are, now getting more sort of competent with Zoom and they're getting creative with backgrounds,
Mm-hmm.
Or, there's that day when, the most critical day of any meeting you had and somebody took out a poll in your neighborhood and your connectivity's down.
Mm-hmm.
And you're challenged and the only thing you've got is, your telephone to connect. And how do you put on your best professional sort of presentation with that? And then you've got a call, somebody's going to get creative. And then today they're going to use Teams. And gosh, never used Teams before. Now I've got to go accumulate, download this, that. And I didn't think ahead to look for that. And, now I'm scrambling and, I'm not only late, but I'm sort of, feeling less confident, or somebody's using Skype, or somebody's using WebEx, or whatever those things are that catches people off guard, and they feel like disruptions to your sort of flow, to your momentum of that day and moment.
Makes sense.
So what about kids? What is some advice for parents?
Yeah. So I mean, once again, I think kids are going to, in many ways, sort of mirror, how the adults in their world are, and I'm talking younger kids for right now, how the adults in their world are managing this, how they're managing the stress, how they're articulating it, how they're, so you could have parents that are beside themselves and they're angry at the world, they're angry at sort of, what's going on around them in our society now, and, have public expressions of all that. And you have others that are sort of recognized and they're talking about it in a way that sort of a kid can sort of competently resonate with. So the uncertainty is manageable. The uncertainty, yes, you can't go to Joey's birthday party. Yeah, we can't have your birthday party. Yeah, I know that, we thought Chuck E. Cheese would be a good place, but, so how do you talk virus to kids? How do you talk you've got all these new classmates that you may have never met, things like that. And then older kids, who are, once again, they're old enough, they're digesting their own sort of social media pieces. They're out there, they're developing their own opinions and their own expressions of that. And, just even sort of, mask, yes, no. What's the proper mask? What's the best way of wearing one? And they're casting their judgments and aspersions willingly to anyone who's, around them. So I'm talking about your sort of typical surly adolescent, let alone sort of adult children who've, had to sort of regroup at home, given changes in sort of employment status and things like that. And everybody is around them, around each other. So I think it's all sort of, managing that. And then I think, you mentioned when you started off that many people are in caregiver roles, whether those are people they're caring for in their house or whether they're, primary caregiver for somebody who's living independently and trying to sustain that independence. And how do you do that? And how do you, make that work? And how do you sort of make that work by not creating risks?
So what services are available? So you sort of talked about all the different things that we're all dealing with. What services are available through Highmark?
Well, through Highmark, once again, it's sort of at the lowest end of sort of the continuum of care would be outpatient treatment, outpatient therapy. Easy enough, no authorization, You can identify a clinician through the network directory and talk. Now, some of our some of our clients, also have access to some digital modes of care, and there's some phenomenally evidence-based practice models around behavioral health that are science-based and use computer-based technology, some applications of AI. Those are also quite effective and quite useful in
So
terms
where do
of.
they find that information? Maybe we can put that out and share it.
Well,
How do they
once
find
again,
it?
some of that is sort of client dependent. So
Okay.
so a particular employer may opt to have those available resources, whereas others don't. There are also apps available
Mm-hmm.
around anxiety or sort of mindfulness.
Mm-hmm.
People have continued sort of the practice of things like meditation, yoga, have found alternatives to sort of practice their spiritual life, church life in sort of alternative ways, and those are all positive aspects that get back to sort of normalizing, and they also provide some of that
Mm-hmm.
sort of stress relief that many people need.
So to access that through Highmark, would they reach out if they are using Highmark, they would reach out to where?
Well, I would suggest calling the number on the back of the card, sort of reviewing their particular
Okay.
benefits,
Okay.
talking to member services, and from there being linked to the resources that are available with how their benefits are structured.
Okay. And have you seen an influx in terms of requests for services during COVID? We mentioned earlier.
Yeah.
You have. Okay.
Yeah, no, absolutely. I mean, we did see sort of a downswing in some of the more restrictive levels of care
Mhm.
early on in COVID, which makes sense, in
Mhm.
terms of some of the group living kind of environments and the residential and the inpatient stays because of the risk of transmission. But what we've seen is that's picked up as the providers are once again getting more competent
Mhm.
in managing the risks associated with that. My biggest concern are the things that we don't know. So if by looking at just sort of EMS utilization patterns, so we're seeing more sort of opiate overdoses, and the risks associated with that are people using in greater isolation than they had before. We're hearing stories of people who are now trapped with others, and they're trapped with abusers. They're
Yeah.
trapped with people who are incredibly unpleasant. They're victimizers. They're
Wow.
so we're seeing some risks. We're hearing anecdotally of increased risk around suicide attempts, suicide completion, and sort of we're waiting for some data on a lot of that. And our primary tool until we get some sort of clarity, and there's certainly a lag in some of this data, but getting messages like this out there, that stigma is a factor, that stress and anxiety are absolutely real, and asking for help, putting your hand up is sort of the best strategy. And then each of us, who knows others, sort of reaching around and, are you okay?
Mhm.
I'm noticing this difference, or can we talk? Can I help
Yeah.
you connect to services? Because I think I think you're a little beyond where you usually are when you're having a bad day.
So I know we're coming to an end, and I just want to wrap it up because, and Matt Berlando actually made a statement here with sort of a question, like how do we balance the health impacts of COVID, for those compromised health conditions, with the imminence of physical, shutdowns,
So
particularly like the social interaction, you've got Thanksgiving, you've got,
yeah,
holidays behind that.
I would say that the risk that COVID presents wins. So that has to be the first priority. We then accommodate everything else around that by managing and mitigating that risk. And I think it's critical, and some of the stuff that we see more recently is coming to a consistent message that it's not just sort of the state is telling me I have to do this, but then even as an employer, I'm aligning with these standards of how to manage COVID. So it's not just something that's being imposed on me from outside,
Right.
but as an employer, I'm training my employees because my business model is dependent on the health and welfare and productivity of my folks, and I need them to do A, B, and C. So I think that's critical. So I think that COVID messaging is first, because it takes away some of that ambiguity in that sort of what if, and that it's others doing this to me, as well as, the incongruence of people, how they carry themselves in the workplace, espousing broad, non-science-based opinions around COVID, for instance.
Well, we are very committed at the Tech Council in supporting our member companies and their leaders in talking and supporting and making sure that the resources are available. We will do whatever we can to make sure that we talk about things to eradicate stigma, since it's so prevalent, and it's prevalent even outside of COVID. And I think that's important. When you focus on productivity, very often it's hard to remember that there's a whole piece of the human that matters, that just matters. And the empathy is something that we can all learn. I know I have to work on it each and every day, and it's not necessarily easy. So I really appreciate, Demetrios, for you joining us today. I really hope that if people use Highmark, that you reach out to the resources that Lexi on our team, Collins, put out, and reach out on the back of your card if you use Highmark, and make sure that you're leveraging the resources. There's nothing, err on the side of caution. Always err on the side of caution would be my advice. That, don't think you can always just shake things off. And I like the way that you set the stage, Demetrios, and talked about it's those little things, even during the course of a day, of getting up, going to work, seeing a barista, talking to someone on the street for a second, having accidental conversations that we're not having now. And that is part of the socialization and human need that is not embedded into many of our lives. And then on the other end, people who are absolutely, consumed with lots of people to be responsible for and to care about. So I don't want to end a Friday on a Friday the 13th and November. It's a beautiful day out. I know that we're headed into winter. We're going to continue to try to weave into the conversations that we have on business as usual around the matters of mental health, and try to eradicate that stigma and make sure that we are doing what we can to be helpful to the community. So if anyone who's listening has ideas and wants us to talk about this more, you can reach out to Jonathan Kirsting, you can reach out to myself, and we will do whatever we can to make sure that the resources and the conversations continue. So thank you, Highmark, for the work that they do in behavioral health. This is just one small piece of their work, but really appreciate Demetrios joining us. So I'm asking everyone, wear a mask, stay safe, be practical, be considerate of others, and have just a really great weekend trying to unplug. So thank you all.
Sounds great.
Who do we have on Monday, Jonathan?
Monday, we have Motional stopping by, one of Pittsburgh's newest automated driving companies. Really fun stuff.
Wow, okay. That's great.
Audrey, I should also say we should have Demetrios or someone else from Highmark stop by every 6 weeks or so, just to kind of keep us on the straight and narrow, because there's been some great tips today. I think our crowd really appreciates.
That's a good idea.
Yeah, well, I have more on my team that have other messages as well, so we certainly can.
Yeah, that's great. So thank you so much, Demetrios. Stay safe.
Thank you.
Okay.
Have a great weekend. Bye.
You too.